रुको रुको इस वीडियो को छोड़ने से पहले इस सॉफ्टवेयर
So hello students. Hello. So let us today discuss about the lower limb. Okay, now that we have discussed the other systems, we'll start with the lower limb. Lower limb is a small topic. 4-5 LAQs है which you have to know in the lower limb. Okay, but we'll quickly go through the various topics of the lower limb. Chalo, we'll start. I'm starting here. Hello. So identify these muscles also. So in the Vivas, in the practical exam, it will be easy for you. Chalo, we'll start. What is this muscle? Number one. What is this muscle? That's a sartorius. Sartorius. What is this muscle? Number two. That's the adductor longus. And this is the inguinal ligament. So laterally is the medial border of sartorius. Medially is the medial border of adductor longus. The floor is formed by the inguinal ligament, and this is the femoral triangle. Clear? So femoral triangle is a very important standard MCQ asked in all the universities all over India. Okay, and it's a very easy question to attempt. Content भी बहुत है उसमें, content is large, so you can always try this MCQ, try this LAQ, sorry. Okay, so femoral triangle, the lateral boundary is formed by the medial border of sartorius, the medial boundary is formed by the medial border of adductor longus, the base is formed by the inguinal ligament, and what is going to form the floor of the femoral triangle? Students, the floor of the femoral triangle number, I'll write it as A. What is this? Iliacus. This B is the psoas major, C is the pectineus, and D is the adductor longus itself. So floor of femoral triangle is formed by iliacus, psoas major, pectineus, and the adductor longus muscle itself, right? What are the contents of femoral triangle? The femoral artery and the femoral vein enclosed in the femoral sheath. Femoral artery and vein enclosed in the femoral sheath. Next is the femoral nerve. Next, the femoral branch of genitofemoral nerve. We have seen the genitofemoral nerve which lies on the psoas major. The genitofemoral nerve divides into a femoral branch and a genital branch. The genital branch of genitofemoral nerve enters the spermatic cord or the round ligament. The femoral branch of genitofemoral nerve comes in the femoral triangle. Where we'll see this? Okay, then is the lateral cutaneous nerve of thigh. I've told you this also, students. The lateral cutaneous nerve of thigh is a branch of lumbar plexus. Compression of this lateral cutaneous nerve thigh against the inguinal ligament leads to, yes, the meralgia paresthetica. Meralgia paresthetica, correct? Then we have got this deep inguinal lymph nodes. Deep inguinal lymph node. This becomes the contents of femoral triangle. Clear? Answer this MCQ. Floor of femoral triangle is formed by all except. So iliacus is there, pectineus is there, psoas major is there, adductor longus does not form the floor of femoral triangle. Correct? Okay. Now understand this. This is a side view. These are the three muscles of the anterior abdominal wall. That's the external oblique. That's the internal oblique. That's the transverse abdominis. Can anyone tell me what is this green colored structure behind the transverse abdominis? Come on, bachcho. External, internal, transverse abdominis. What is that green colored fascia behind the transverse abdominis? Yes, that's the fascia transversalis. Fascia transversalis. And this muscle is the iliacus. Iliacus. And what is this green colored structure which covers the iliacus? That's the fascia iliaca. Fascia iliaca. So fascia transversalis comes down from the anterior abdominal wall. Fascia iliaca comes down from the pelvis. Together, these two fascias are going to form the femoral sheath. Right? So how is the femoral sheath formed? Anteriorly is the fascia transversalis. Posteriorly is the fascia iliaca. So that is how the femoral sheath is formed. Now this femoral sheath has got three compartments. Yes, this is very important. A femoral sheath. I'll make it like this for you. Three compartments of the femoral sheath. The lateral compartment, the intermediate, and the medial compartment. What is present in the lateral compartment? The femoral artery plus the femoral branch of genitofemoral nerve. What is present in the middle compartment or the intermediate compartment is the femoral vein. and the medial compartment is empty. What do you call this as? Femoral canal. The medial compartment is known as the femoral canal. The upper part of femoral canal is known as the femoral ring. Yeah, bachon, clear? So femoral sheath, anteriorly fascia transversalis, posteriorly is the fascia iliaca, right? Three compartments of the femoral sheath. Lateral compartment contains the femoral artery and the femoral branch of genitofemoral nerve. The intermediate compartment contains the femoral vein. The medial compartment is known as the femoral canal. It's empty. Right, the upper boundary of the femoral canal is known as the femoral ring. And what are the boundaries of this femoral ring? A very important MCQ. I'll just put number A, B, C and D. Come on students, the anterior boundary of femoral ring is formed by what? Any guesses? Yes, the anterior boundary of femoral ring is formed by the inguinal ligament. Inguinal ligament is also known as the Popart's ligament. Popart's ligament, right? So inguinal ligament also known as the Popart's ligament. One moment, I'm not able to see the comments. Popart's ligament. What is the medial boundary of the femoral ring formed by? The medial boundary is known as the lacunar ligament. Lacunar ligament. Hello, good evening. Hi Shantanu. Oh sorry, I was not able to see the comments. Ab dikh raha hai. Okay, now it is. Is everything clear to all of you? Arey bacha, Amit, what are important I will be able to cover. I can't cover each and everything, no? In the short span of time, jo important topics are only that much I can cover, right? Clear? So anterior, clear Amit? So anterior boundary of the femoral ring is formed by the inguinal ligament. The medial boundary is formed by the lacunar ligament. The lacunar ligament is also known as, any guesses? Come on, bacho. The lacunar ligament is also known as Gimbernet's ligament. Gimbernet's ligament. Gimbernet's ligament. The posterior boundary is formed by, yes, I'm looking at the comments. Boliye, the posterior boundary is formed by the pectinate ligament. So anterior boundary is the inguinal ligament, medially is the lacunar ligament, also known as the Gimbernet's ligament. Posterior boundary is formed by the pectinate ligament, also known as the Cooper's ligament. Cooper's. And what is the lateral boundary formed by? The lateral boundary is formed by the septum, which separates it from the femoral vein, right? The septum which separates it from the femoral vein. So that's the femoral ring. Now this femoral ring is wider in females, correct? The femoral ring is wider in females. Why? Because the pelvis is wider in females and the blood vessels are of smaller size. So wider pelvis and the smaller size of the blood vessels, the femoral ring is therefore larger in females. Chances of femoral hernia are therefore very common in females. Chances of femoral hernia are very common in females, right? Now you tell me, if there's a femoral hernia, you have to reduce. How's the direction of femoral hernia? This is very commonly asked in the exams. It is downwards, forwards and upwards. The direction of femoral hernia, it's downwards, forwards and upwards. So when we reduce the femoral hernia, we go downwards, posteriorly and upwards. Reverse mein jate. We go in the reverse direction, right? So now, if there is a femoral hernia, you have to dilate the femoral ring. You have to cut one of the boundary of the femoral ring. Yes, what do you cut? Which boundary of the femoral ring do we cut? Bacho, can anyone answer this? Which boundary of the femoral ring do we cut? We cut the inguinal, we cut the lacunar ligament. We cut the lacunar ligament. Clear? So we cut the lacunar ligament, we dilate the femoral ring, we push the contents back and we put a mesh here. Fine, everything is fine. But occasionally there's something which lies here. Very good. There's something which lies on the lacunar ligament. Anyone? Come on. Yes, Shantanu, very good. Anmol, very good. Shalini, yes. Snehajit, Prithvi, very good. Who else is there? Yes, very good to all of you. All of you answering very well. So fine, lacunar ligament ko cut karte, we dilate the femoral ring, we push the hernia back. But occasionally there's someone who lies on the lacunar ligament. I'm not able to see the chat. That is why I have to go back and come back again. Chalo, bolo bacho. There's something which lies on the lacunar ligament, and that is the abnormal obturator artery. Very good. That's the abnormal obturator artery. It's not the normal obturator artery. It's the abnormal obturator artery. And this abnormal obturator artery is a branch of, any guesses? Abnormal obturator artery is a branch of, yes, inferior epigastric artery. The same inferior epigastric artery which divides the Hasselback's triangle into two parts. So inferior epigastric artery की branch है abnormal obturator artery which lies on the lacteal ligament, and when we cut this artery it leads to hemorrhage. Right, so you have to know this. Fine, clear to all of you? So that's about the femoral shape, femoral ring, the boundaries of femoral ring, how to reduce a femoral hernia. Clear? Okay, very good. Very good. Excellent. Very good to all of you. You're answering very well. So this is about the femoral triangle. Now you tell me the anterior compartment of the thigh, the muscles in the anterior compartment of the thigh. Just quickly go through this. The muscles in the anterior compartment of the thigh. The first muscle here. One moment. A quick go through this. The first muscle here is the sartorius. Sartorius. Origin of sartorius, anterior superior iliac spine. It crosses the hip joint from the lateral to the medial side. It crosses the knee joint and is inserted on the medial aspect of the shaft of tibia. Medial aspect of the shaft of tibia along with two other muscles. Chalo, name these muscles. So sartorius along with two other muscles are inserted on the medial aspect of the shaft of tibia. Very good, Patel. Yes. एक sartorius है. Who are the other two muscles? One comes from the anterior compartment, one comes from the medial compartment, one comes from the posterior compartment. Together, these muscles are known as the gyropes. Gyropes. Very good to all of you. Yes. एक sartorius हो गया. The second one is gracialis and the third one is semitendinosus. So sartorius from the anterior compartment, gracialis from the medial compartment, semitendinosus from the posterior compartment. Together, these three muscles are known as gyropes, inserted on the medial aspect of the shaft of tibia. Perfect. All these three muscles का common action है. What is the action of all these three muscles on the knee joint? Common action. Yes, बच्चों, come on. Very good, Shruti. Very good, Vinay. Gyropes is a support. It's a support. That is the meaning of gyropes. It supports the pelvis on the femur. It supports the pelvis on the femur. Fine. Yes. Bolo. What is the action of these three muscles on the knee joint? It is flexion and medial rotation. So flexion and medial rotation at the knee joint. So what is the action of sartorius now? Sartorius on the hip joint, sartorius on the knee joint. A very, very important viva question. On the hip joint, the sartorius does abduction and lateral rotation and flexion. Abduction, lateral rotation and flexion at the hip joint. On the knee joint, it does flexion and medial rotation. Sartorius is therefore known as a Taylor's muscle. Yes, sartorius is also known as a honeymoon muscle. Remember, honeymoon muscle is sartorius. Yeah, you understand the actions, you will understand it. There's another muscle whose actions are exactly opposite to that of sartorius. Yes. Yes, Anmol, yes. There's another muscle whose actions are exactly opposite to that of sartorius on the hip joint. Sartorius क्या करता है? It does abduction, lateral rotation at the hip joint. What does this muscle do? It does adduction and medial rotation at the hip joint. Knee joint pe action is the same, flexion and medial rotation. This muscle is the gracialis. Gracialis. Gracialis is also known as, complete the sentence. Gracialis is also known as. Just sit back and listen to the lecture, okay? I'll try to revise whatever maximum I can. Yes, very good, Saran, very good. What is the gracialis also known as? Like sartorius ko we call it as honeymoon muscle. What is gracialis known as? Muscle of virginity. Yes, it is known as an anti-rapist muscle also. Anti-rapist muscle. Perfect. So that's about the sartorius, the longest muscle in the body. Plenty of MCQs on the sartorius. Now coming to the second set of muscles. Yeah. So what is this straight muscle? A straight muscle is rectus femoris. 3 is vastus lateralis. 4 is vastus medialis. And we remove this rectus femoris. Iske niche, below that is the vastus intermedius. Vastus intermediate. So if I draw this as femur here, a section through the femur. I draw this section through the femur. Okay, very good. So what is this muscle? On the medial side is vastus medialis. On the lateral side is vastus lateralis. That's the vastus intermedius, and above this is the rectus femoris. Together, these muscles are known as quadriceps femoris. Quadriceps femoris. Out of this, vastus medialis, vastus lateralis, vastus intermedius, they arise from the femur. Whereas rectus femoris has got two heads. Anyone? Rectus femoris has got two heads. One is the straight head and the other one is the reflected head of rectus femoris. The straight head arises from the anterior inferior iliac spine. हाँ बच्चा Patel, I'll draw that. Draw करता हूँ. So the straight head of rectus femoris. Rectus femoris has got two heads. One is the straight head, one is the reflected head. The straight head of rectus femoris arises from the anterior inferior iliac spine, and the reflected head of rectus femoris arises just above the acetabulum. It's just above the acetabulum. That's the origin. So out of this quadriceps femoris, bachcho, which muscle is going to act on the hip joint? Rectus femoris. Clear? Why? Because rectus femoris is going to cross the hip joint. It lies in front of the hip joint. So what does it do? Flexion at the hip joint. So if you know these muscles, you automatically know the relations of the hip joint. You know the actions of the hip joint. So hip joint ka flexion hoga. Flexion would be done by rectus femoris. Flexion would be done by sartorius. Flexion would also be done by iliacus and psoas major. Clear? Okay. Now, where is the insertion? Bacho, where is the insertion of this quadriceps femoris? Where is the insertion of quadriceps femoris? This quadriceps femoris together, these four muscles, they form a common tendon, and this common tendon is inserted on the base of the patella. Look at this. It is inserted on the base of the patella, and from this base of the patella, there's a ligament which begins. What is this ligament known as? That's the ligamentum patellae. That's a ligamentum patellae which is inserted on the tibial tuberosity. Okay. So this quadriceps femoris is inserted on the base of the patella, and the ligament continues, which is known as the ligamentum patellae, attached to the tibial tuberosity. What is the action of this quadriceps femoris? It causes extension at the knee joint. So, bacho, if the examiner is going to ask you what is the action of quadriceps femoris, you say extension at the knee joint, and the rectus femoris alone causes flexion at the hip joint. That's what is expected from you. Second thing which this quadriceps femoris does is locking of the knee joint. Good evening to all of you. What is locking of the knee joint? Locking. So now just try to understand this, bacho. Now you're sitting on the chair watching the lecture. Your knee joint is flexed like this. That's the tibia, that's the femur. The knee joint is flexed. When we stand up, when we put the foot on the ground, and when we do an extension at the knee joint, okay, we're doing an extension at the knee joint, the lateral condyle of femur articulates with the lateral condyle of tibia. Same diameter, hai? So lateral condyle of femur fits into the lateral condyle of tibia, but the medial condyle of femur is larger in diameter, so it is not articulated as yet. When we extend the knee joint, the lateral condyle of femur articulates with the lateral condyle of tibia, but the medial condyle of femur is larger. For this to completely articulate, the femur has to undergo a medial rotation, and this is what we call as locking of the knee joint. So what is locking of the knee joint? It's the medial rotation of femur during the final stages of extension. Yes, Rutvi, very good. It's the medial rotation of femur during the final stages of extension when the foot is on the ground. Okay, so that is locking of the knee joint. So if you have to unlock the knee joint, the femur has to be laterally rotated. Locking mein kya hota hai? The femur rotates medially. So unlocking mein the femur has to rotate laterally, and this is done by whom? Popliteus. Once the femur is laterally rotated, the knee joint is unlocked. Once the knee joint is unlocked, flexion can occur, and this is done by whom? Popliteus. So who's an unlocker of the knee joint? Popliteus. Who's a locker of knee joint? Quadriceps femoris. Perfect. Clear hai bachcho? Fine till here? Clear till here? Okay, perfect. Very good. So we come to now we come to nerve, this compartment, femoral nerve. Another very important, another very important short note is femoral nerve. Now, femoral nerve is a branch of which plexus? The lumbar plexus, or you can say the lumbosacral plexus. Lumbar plexus or the lumbosacral plexus. What is the root value of femoral nerve? बच्चों बोल सकते हो? What is the root value of femoral nerve? See, it is L2, L3, L4. What is this? Ventral rami. Ventral rami of L2, L3, L4 now divides into a dorsal division and a ventral division. Very good. So the dorsal division of ventral rami of L2, L3, 4 forms the femoral nerve. And what is this going to form? Obturator nerve. That's the easiest way to understand this. So femoral nerve ka root value is what? It is formed by the dorsal divisions of the ventral rami of L2, L3, L4. And the obturator nerve is formed by the ventral divisions of the ventral rami of L2, 3, 4. That's the obturator nerve. Clear? L2, 3, 4 is common. Femoral nerve is dorsal division. Obturator nerve is ventral division. Perfect? Now, this femoral nerve comes below the inguinal ligament. Okay. The femoral nerve will come below the inguinal ligament. The femoral nerve has got a main trunk and it has got two divisions. It has got a trunk, it has got an anterior division and it has got a posterior division. So what are the branches from the trunk? Branches from the trunk is one is nerve 2 iliacus. Nerve 2 iliacus and the second one is nerve 2 pectineus. So branches from the trunk, one is nerve 2 iliacus, one is nerve 2 pectineus. Which half of pectineus? That's the lateral half of pectineus, lateral half. The anterior division gives, yes, the anterior division gives one muscular branch and two cutaneous branches. One muscular and two cutaneous branch. Muscular branch is given to sartorius. So, bacho, if anyone is going to ask you what is the nerve supply of sartorius, one student answers femoral nerve, the other student answers the anterior division of femoral nerve. You understand the difference now? So, it is the anterior division of femoral nerve. Yes, Najib. So, nerve, that is nerve to sartorius, two cutaneous branches. What are the cutaneous branches? Cutaneous branches medial and anterior. Cutaneous nerve of thigh. Medial and anterior cutaneous nerve of thigh. Anterior is also known as intermediate cutaneous nerve of thigh. So medial femoral cutaneous nerve of thigh, anterior cutaneous nerve of thigh, or the intermediate cutaneous nerve of thigh. Same. These are the branches from the anterior division. Anterior division gives one muscular branch, two cutaneous branches. Posterior division. Okay, I'll just clear this. Posterior division gives what? Posterior division gives four muscular branch and one cutaneous branch. Four muscular, one cutaneous. Four muscular branches are given to quadriceps femoris. मतलब वो चार, four of them. Quadriceps femoris, one cutaneous branch. चलो बच्चों, can anyone answer this? What is the cutaneous branch from the posterior division of femoral nerve? MCQ is largest cutaneous branch of femoral nerve. Come on. Largest cutaneous branch of femoral nerve. Any guesses? Answer. Largest cutaneous branch of femoral nerve. That's the saphenous nerve. Saphenous nerve. A very important MCQ. Very good, Snehajit. Very good, Shalini. Yes. That's the saphenous nerve. This saphenous nerve is the largest cutaneous branch of femoral nerve, and this saphenous nerve is going to supply the skin. Oh, one moment. Look at that. This saphenous nerve is going to supply the skin on the medial aspect of the leg, and the foot, up to the great toe, not the medial aspect of great toe. It supplies the skin on the medial aspect of the leg and the foot up to the great toe. Up to the great toe. I'll just draw this for you. Look at bacho, what I'm drawing now. This all comes in MCQs also. I'm drawing the sole of the foot. Ye plantar aspect hai, sole of the foot. Chalo bachcho, who supplies the skin on the medial aspect of the foot up to the great toe. Medial aspect of the foot up to the great toe. That's a saphenous nerve. Who supplies the skin on the medial aspect of the foot up to the great toe? That's saphenous nerve. Who supplies the skin on the medial aspect of the great toe? All the web spaces, all the web spaces. Yeah, these are the web spaces except the first. Shall I answer this? Answer this. This you should know, but this is a very, very important MCQ for you as well as for the NEET PD also. Who supplies the skin on the medial aspect of the great toe? This is the, yes, this is the superficial peroneal nerve. Superficial peroneal nerve. All the web spaces are also supplied by the superficial peroneal nerve, right? The first web space where we put our slippers, here, this is supplied by what? The deep peroneal nerve. The first web space is supplied by the deep peroneal nerve. Clear? And the lateral aspect of the foot. I can't see the comments. The lateral aspect of the foot is supplied by, yes, the lateral aspect of the foot is supplied by sural nerve. This is very important. This is extremely important. So we have drawn the sole of the foot, the medial aspect of the foot up to the great toe, that's saphenous nerve. Medial aspect of the great toe skin is supplied by superficial peroneal nerve. All the web spaces, superficial peroneal nerve. The first web space, deep peroneal nerve. The lateral aspect of the foot, sural nerve. Sural is a branch of tibial nerve, which is the nerve which supplies the skin over the heel of the foot. Heel is supplied by tibial nerve. Heel is supplied by tibial nerve. Yes, bacho, very good. Now, this 3.5 fingers, can anyone tell this 3.5 fingers is supplied by which nerve? 3.5 fingers. 3.5 fingers is supplied by the medial plantar nerve. Medial plantar nerve, and this is supplied by lateral plantar nerve. Excellent, very good. So medial and lateral plantar nerve, very good, Ritvi. Medial and lateral plantar nerve, both are branches of what? Tibial nerve. Both are branches of tibial nerve. Matlab tibial nerve divides into a medial plantar nerve and a lateral plantar nerve. Medial plantar nerve supplies the skin on the plantar aspect of 3.5 fingers, and 1.5 fingers के skin को कौन supply करता है? Lateral plantar nerve. My dear children, can you tell me this medial plantar nerve resembles to which nerve of the upper limb? Which was the nerve which was supplying the skin over this 3.5 fingers of the hand? Which was that nerve? So the medial plantar nerve resembles to which nerve of the upper limb? Come on, bacho, come on. Yes, that's a medial nerve. Very good, medial nerve. And the lateral plantar nerve corresponds to which? Ulnar nerve. Clear? Clear to all of you? Same, exactly same. So medial plantar nerve supplies less number of muscles in the sole of the foot, more of the skin. Same like medial nerve in the hand. Lateral plantar nerve is same like ulnar nerve, supplies many muscles in the sole and less of skin. Perfect. Okay, perfect. This diagram, just keep this in the mind. Okay, great. Clear? है femoral nerve, trunk है, anterior posterior division है, branches from the trunk. One is nerve to iliacus, one is nerve to pectineus. Anterior division gives one muscular branch to sartorius, two cutaneous branches, the medial and anterior cutaneous nerve thigh. Posterior division gives 4 muscular branches to quadriceps femoris, 1 cutaneous branch. That's the saphenous nerve. That's the femoral nerve. Okay, and make flowcharts. Make flowcharts wherever you can. Yes. Coming to the medial compartment of the thigh. Medial compartment of the thigh, come on, if you can name the muscles here. This muscle which is cut here. Chalo, bacho, answer this. This muscle, the first muscle here which is cut here. What was this muscle? The first muscle here is adductor longus. Okay, that's adductor longus. We remove the adductor longus. Below the adductor longus, if we remove this, yeah, what is this muscle? That's the adductor brevis. Adductor brevis. Below the adductor brevis, what is this muscle? Adductor magnus. So this is adductor longus, then adductor brevis, then adductor magnus. What is this muscle? A thin and slender muscle. What is that? Gracialis. Gracialis, right? Gracialis. There was a muscle which was beginning from the pecten pubis and which was coming and getting inserted on the posterior aspect of femur. ये कौन है? Can anyone tell me what is this muscle? Begins from the pecten pubis. It begins from the pecten pubis, goes behind, and gets inserted below the lesser trochanter of femur. What is this muscle? On the lesser trochanter is iliacus and psoas major. Barabar hai? Just below the lesser trochanter is this muscle. What is this muscle? Pectineus. Excellent. Very good. That's the pectineus muscle. So that's a pectineus muscle. Which are the muscles in the medial compartment of the thigh? Adductor longus, adductor brevis, adductor magnus, brachialis, pectineus. And when we remove this pectineus, bacho, have a look. When we remove this pectineus, can anyone tell me what is this muscle? I put a star for you. What is that muscle? This muscle lies below the pectineus. We can't see this muscle. You have to remove the pectineus. Tabhi ye dikhta. What is this muscle? Rectus nahi hai bacha. Rectus nahi hai wo. Rectus is very superficial. Rectus superficial hai bacha. What is this muscle in the medial compartment of thigh? And the very characteristic of this muscle is uska action is different than the rest of the muscles in the medial compartment of the thigh. Come on, that should give you a hint. Yes, very good, Rutvi. That's obturator externus. Excellent, very good. That's obturator externus, bacha. And this obturator externus is inserted into the trochanteric fossa. Externus evo. Normally, we are not able to see the obturator externus. Very good, YouTube learner. Normally, obturator externus we can't see because it is covered by pectineus. अब ये जितने भी muscles है ना, all these muscles, what is the action of all these muscles? They cause adduction, okay, and they turn the thigh inwards. What is this? Medial rotation. So action of all the muscles of medial compartment is adduction and medial rotation at the hip joint. What is different about the obturator externus? Obturator externus is the only muscle in the medial compartment which does what? What is the action? Come on. Obturator externus ka insertion dekho, it is going backwards, behind, and getting inserted on the posterior aspect of the femur. So when this muscle contracts, it is going to turn the femur outwards. What's that? Lateral rotation. Excellent. Very good, bacha. Very good. That's lateral rotation at the hip joint. So remember, students, all the muscles in the medial compartment, they do adduction and medial rotation. One exception is obturator externus, which does lateral rotation at the hip joint. Perfect. Clear hai bachcho? Right. Which is the nerve of this compartment? The nerve of this compartment is the obturator nerve. Okay, we don't get LAQ on this, but this medial compartment of leg is very important from practical point of view. Plus we get short note on obturator nerve. Yes, what is the root value of obturator nerve? It's a branch of lumbar plexus. It is formed by the ventral divisions of the ventral rami of L2, L3, L4. Obturator nerve is related to this. Ye dekho, this is the obturator nerve, correct? What is this part of the sacrum? Bacho, what is this part of the sacrum? What is this part of the sacrum? This is the sacral promontory. The body of S1 is known as sacral promontory. What are those two wings of the sacrum known as? Ala of the sacrum. Ala of the sacrum. So obturator nerve is related to the ala of the sacrum. Correct? Obturator nerve is related to the ala of the sacrum. Look at this. Now this obturator nerve goes along the pelvic walls. One moment. This obturator nerve goes around the pelvic walls and gets out through this foramen here. What is that? Obturator foramen. Yes, it is related to the ala of sacrum. It winds around the pelvic walls. As it winds around the walls of the pelvis, bacho, there's an organ here in females which it is related to. What's that organ in females? What's that organ in females to which the obturator nerve is related to? Hello, Bipin, bacha. That's the ovary. Very good. That's the ovary. Vinay, that's correct. That's the ovary. And this obturator nerve forms the lateral boundary of a fossa, which is known as the ovarian fossa. Ovarian fossa. Just remember, obturator nerve is laterally related to the ovary. So when there's an inflammation of the ovary, who's irritated? Obturator nerve. Where is the pain referred to? The medial aspect of the thigh. That's a clinical question for you. But yaad rakhna bachcho, just try to correlate this. Okay, a female patient complains of pain on the medial aspect of the thigh since 3 to 4 months. On examination, on a sonographic examination, the ovaries are found to be inflamed. Okay, so obturator nerve forms what boundary of the ovarian fossa? So that is how the clinical question is going to be. Perfect. Okay, now this obturator nerve, once again, obturator nerve is a branch of lumbar plexus. Root value is the ventral division of ventral rami of L234. Obturator nerve is related to the ala of the sacrum, forms the lateral boundary of ovarian fossa, gets out through the obturator foramen and now divides into, okay, the obturator nerve is now going to divide into an anterior division and a posterior division. It divides into an anterior and posterior division. Okay, I'll write on this side. Obturator nerve divides into an anterior division and a posterior division. This comes for MCQs. Bacha, what is the anterior division of obturator nerve supply? It supplies the adductor longus, adductor brevis, gracialis, and it supplies the pectineus. Which half of pectineus? That's the medial half of pectineus. Medial half. I just told you, bacho, the lateral half of pectineus is supplied by whom? The lateral half of pectineus is supplied by femoral nerve, trunk of femoral nerve. So the lateral half of pectineus is supplied by the trunk of femoral nerve. The medial half of pectineus is supplied by the obturator nerve, anterior division of obturator nerve. Pectineus therefore becomes a composite muscle, a hybrid muscle. Okay, it becomes a hybrid muscle. See, adductor brevis is not a composite muscle, but adductor brevis is supplied by the anterior division. If not supplied by the anterior division, it is supplied by the posterior division. Both of them don't supply. It is either anterior or posterior. What is the posterior division of obturator nerve supply? It supplies the adductor magnus and it supplies the obturator externus. Clear hai bachcho? So anterior division supplies the adductor longus, brevis, pectineus, medial half and the gracialis. The posterior division supplies the adductor magnus and the obturator externus. Perfect. Action of all these muscles of the medial compartment, adduction and medial rotation at the hip joint. Obturator externus causes lateral rotation. One muscle of all this crosses the knee joint, that's gracialis. So what is the action of gracialis on the knee joint? Flexion and medial rotation. So what is the action of gracialis on the hip joint, on the knee joint? Hip joint pe adduction, medial rotation, knee joint pe flexion and medial rotation. Perfect. Hello, bachcho. Clear till here? I have to be fast like this. Huh? It's a quick revision, bacha. And see what are important topics that I'm trying to cover in this short span of time. Okay, very good. Very good. Now coming to this group of muscles, come on. Coming to this group of muscles, this is the hamstring muscle. The posterior compartment of the thigh is known as the hamstring compartment. Which are the muscles here? Look, what is the origin of this muscle? Ischial tuberosity. The origin of all these muscles is ischial tuberosity. Where is the insertion of this muscle? These muscles cross the hip joint. They cross the knee joint. They are inserted on the tibia or fibula. Insertion is tibia or fibula. What is the nerve supply of this muscles? The nerve supply is the tibial part of sciatic nerve. Tibial part of sciatic nerve. And what is the action of these muscles in the posterior compartment? They cause extension at the hip joint and flexion at the knee joint. Extension at hip, flexion at the knee joint. Clear? So hamstring muscles, the posterior compartment of the thigh. Which are the muscles? Chalo, we'll start with the muscles, bacha. Okay, can anyone tell me who's this number one? Number two. Number one, half is a muscle, half is a tendon. What's that? Semitendinosus. Number two, half is a muscle, half is a membrane. Semimembranosus. Right? A muscle which has got two heads. A muscle which has got two heads. What's that? Biceps femoris. That's a biceps femoris. That's a long head of biceps femoris. And that's a short head of biceps femoris. The long head of biceps femoris arises from the ischial tuberosity. The short head of biceps femoris arises from the femur. Clear? The short head of biceps femoris arises from the femur, the linea aspera of femur. Linea aspera of femur. So, bacho, the short head of biceps femoris, is it a hamstring? Yes or no? Come on, answer this. Short head of biceps femoris, is it a hamstring? Hello bachcho, come on. No, short head of biceps femoris is not a hamstring. याद रखना ये short head of biceps femoris is not a hamstring. Why? Because number one, it does not arise from the ischial tuberosity. Number two, it is supplied by the common peroneal part of sciatic nerve. Hamstrings का criteria क्या है? It should be supplied by tibial part of sciatic nerve. Now the short head of biceps femoris is supplied by the common peroneal part of sciatic nerve. So that's not a hamstring. So if I have to tell you the hamstrings, semitendinosus, semimembranosus, the long head of biceps femoris, and number 4, this muscle is the adductor magnus. Number 4 is the adductor magnus. Clear? So these are the hamstring muscles. Origin is ischial tuberosity, insertion is tibia or fibula, nerve supply is the tibial part of sciatic nerve, and actions, extension at the hip joint and flexion at the knee joint. Clear? Who's not a hamstring? Who's not a hamstring? The short head of biceps femoris is not a hamstring. Okay. Chalo. Can anyone answer this? Answer this MCQ. I have to, I can't see the. Chalo, answer this, bacha. Answer this MCQ. Yes, Shalini. Arises from the ischial tuberosity. Okay, arises from the ischial tuberosity. Also, you can take it as true. Fine. But if I have to select, see, इसमें दो answers है. Attached to the head of the fibula is also correct. Biceps femoris is inserted on the head of the fibula. So if I have to select out of this two, out of B and D, what do I select? Yes, Rutvi. Yes, very good. Out of B and D, bacha, if I have to select the best, what do I select? Answer is B. Answer is B. See, B and D both are correct, but more appropriate answer is going to be B, because biceps femoris, both the heads joined together, inserts on the head of the fibula. Fine, arises from the ischial tuberosity is the long head of biceps femoris. The short head arises from linea aspera, correct? Supplied by femoral nerve? No, the long head is supplied by the tibial part of sciatic nerve. The short head is supplied by the common peroneal part of sciatic nerve. Related to the tibial collateral ligament, that's wrong. Who's related to the medial collateral ligament? That's the adductor magnus. Adductor magnus का degenerated part is the tibial collateral ligament. That's a degenerated part of the adductor magnus, tibial collateral ligament, or the medial collateral ligament. Medial collateral ligament. Clear, बच्चों? Fine, clear to all of you? एक मिनट, वो adductor canal I have to tell you ना, adductor canal. Just try to understand this adductor canal. On 1 minute. See, bachcho. Okay, just tell me, what is this muscle? What is this muscle which is present on the medial aspect of the shaft of femur? What is this muscle in green that I've drawn? Let me see if you can understand this. What is this muscle in green? That is why adductor magnus is a hamstring. Very good. I take a section here. That's the femur. What is this muscle that I've drawn for you? That's vastus medialis. Sartorius नहीं है बच्चा. Sartorius नहीं है. It is attached to the femur. देखो ना बच्चों. Sartorius is not attached to the femur. Sartorius is not at all attached to the femur. This muscle is attached to the femur. It begins from the medial aspect of the femur. That's vastus medialis. Right? Now you tell me, bacha, what is this muscle? What is this muscle? Here. What is this muscle? This is adductor longus. And what is this muscle? Adductor magnus. Adductor longus, adductor magnus. So if I take a section from here, I'll be able to see the adductor longus. If I take a section from here, I'll be able to see the adductor magnus. Okay. So एक ही muscle दिखता है, but I'm drawing both the muscles for you. Sorry. I'm drawing both the muscles for you. Look, bachcho, Look, this muscle is what? Adductor longus. If we go in the lower part, what is this muscle going to be? Adductor magnus. Adductor longus is in the upper part, adductor magnus is in the lower part. समझ में आ रहा है? So above is vastus medialis, below is adductor longus above and adductor magnus below. And what is this muscle now? What is this muscle? Sartorius. Clear है बच्चा? This is the adductor canal. That's how the adductor canal is. So adductor canal का boundaries क्या है? हाँ, subsartorial plexus is there. That's fine. Subsartorial plexus is below the sartorius. So how's the adductor canal formed? Who's above vastus medialis like this? ऐसे ऊपर is vastus medialis, below is the adductor longus and adductor magnus, and the roof is formed by sartorius. That's the adductor canal for you. What are the contents of adductor canal? Clear है ना बच्चा? Who was asking adductor canal? Clear to all of you? What are the contents of adductor canal? Femoral artery, femoral vein, then there's a nerve to vastus medialis, then there's a nerve here, the saphenous nerve, and there's a nerve here. What's that? That's the posterior division of obturator nerve. Posterior division of obturator nerve. So what are the contents of adductor canal? Femoral artery, femoral vein, the saphenous nerve. This comes as a short note, adductor canal. This comes as an MCQ topic also. So femoral artery, femoral vein, the nerve to vastus medialis, the saphenous nerve, and the posterior division of femoral nerve. Am I clear to all of you? So this is a section. ये section मैंने draw किया. Clear बच्चा? Clear to all of you? Are you able to follow this? Okay. So just remember all these things. These topics are very important. Okay, look at this. Now, what is this surface of the ilium known as? This surface of the ilium is known as the gluteal surface of ilium. Now, what is this? This is the greater sciatic notch. That's the greater sciatic notch. That's the anterior superior iliac spine. That's the anterior inferior iliac spine. From the greater sciatic notch to the anterior inferior iliac spine, what is this line known as? That's the inferior. Bacha. Anterolateral and posteromedial. That's also fine. Anterolateral you can say, anterolateral posteromedial. Vastus medialis वही है, same है. So 3. So that's the inferior gluteal line. Okay, from the greater sciatic notch, to the anterior inferior iliac spine is the inferior gluteal line. From the greater sciatic notch to the tubercle, that's the tubercle of iliac crest. From the greater sciatic notch to the tubercle of iliac crest. What is this line? That's the anterior gluteal line. And there's one line which goes behind here. What's this line? That's the posterior gluteal line. Okay, from the greater sciatic notch to the anterior inferior iliac spine, that's the inferior gluteal line. To the tubercle of iliac crest, that's the anterior gluteal line. And one going behind, that's the posterior gluteal line. Right? What is this muscle which arises from here? What is this muscle? Okay, what is this muscle? Sorry. There's a muscle here, there's a muscle here, and there's a muscle here. Come on, answer this. So what is this muscle? That's a gluteus minimus, gluteus medius, gluteus maximus. So gluteus medius, gluteus minimus, and gluteus maximus. So I'm starting with the gluteus maximus. What is the origin of gluteus maximus? It arises from, you get an LAQ on gluteus maximus. It arises from the gluteal surface of ilium behind the posterior gluteal line. It arises from the dorsal aspect of the iliac crest. It arises from the sacrum. Okay, from the sacrum and the coccyx. It also arises from the sacrotuberous ligament. Clear? So what is the origin of gluteus maximus? the gluteal surface of ilium behind the posterior gluteal line, the dorsal aspect of the iliac crest, the sacrum and the coccyx, the sacrotuberous ligament, and the fascia covering the gluteus medius. Can anyone tell me what is that fascia known as? The fascia covering the gluteus medius is known as, any guesses? Yes, bachcho, bolo. What is the fascia which covers the gluteus medius, which gives origin to? हाँ हाँ, BDS वालों को important नहीं है ऋषभ. BDS is not important for BDS, but if you want you can listen to it. हाँ बोलो बच्चों, come on. What is that fascia which covers the gluteus medius known as? This is what we call as the gluteal aponeurosis. Gluteal aponeurosis. You must have read in the book gluteal aponeurosis. So what is the origin of gluteus maximus? It arises from the gluteal surface of ilium behind the posterior gluteal line, the dorsal aspect of iliac crest, the sacrum and the coccyx, the sacrotuberous ligament, and the gluteal aponeurosis. Now this entire muscle comes like this and gets inserted into what? Come on, can anyone answer this? Where is the insertion of gluteus medius? Gluteus maximus. Where is the main insertion of gluteus maximus? This insertion of gluteus maximus is into a tract here, and this is what we call as the iliotibial tract. So the main insertion of gluteus maximus is in the iliotibial tract. A smaller amount is inserted into the gluteal tuberosity of femur. Gluteal tuberosity pe hai, yes, but the main insertion of gluteus maximus, if I ask a student, the student says the main insertion of gluteus maximus is what? Iliotibial tract. That's the first answer. Huh? Iliotibial tract. Clear hai bacha? The first answer should be the iliotibial tract. The second is the gluteal tuberosity of femur. Yes, very good. Tensor fascia lata, tensor fascia lata nahi, iliotibial tract. What is this muscle? This is the tensor fascia lata. So two muscles inserted into the iliotibial tract, that's the gluteus maximus and the tensor fascia lata. Two muscles are inserted into the tract here, that's the iliotibial tract. Yeah. What is the action of gluteus maximus? Can anyone tell me what is the main action of gluteus maximus? Yes, anyone? Action of gluteus maximus is, it is the chief extensor, lateral rotator. It's a chief extensor at the hip joint, it's a lateral rotator, and it's an abductor of the hip joint. That's the main action of gluteus maximus. It's a extensor, it's a lateral rotator, and it is a abductor of the hip joint. Yes, bacho? To the iliotibial tract, it does extension at the knee. To the iliotibial tract, it's not direct. To the iliotibial tract, it does extension at the knee joint. Very good. So that's the gluteus maximus. What is this muscle? Can anyone tell me what is this muscle? That's the gluteus medius. And what is this muscle? That's the gluteus minimus. Gluteus minimus. Where is the insertion of gluteus medius? It's inserted on the lateral aspect of the greater trochanter. Lateral aspect of greater trochanter. Yeah. So where is the insertion? Yes, helps in climbing. Very good, very nice. Yes, you're answering very well. Chalo, good. If you want a viva, you tell me. I'll take a viva of yours. Okay. Just inform. I'll tell the team. It will be a 1-to-1 viva. Okay. I'm known to take vivas. Okay, fine. So where is the gluteus medius inserted? On the lateral aspect of greater trochanter. Bacho, what is the main action of gluteus medius? Abduction at the hip joint. Abduction. And gluteus minimus is inserted on the anterior aspect of the greater trochanter. Gluteus minimus is inserted on the anterior aspect of the greater trochanter. When this contracts, what does it do? Medial rotation at the hip joint. medial rotation. So just remember this: gluteus medius does abduction, and gluteus minimus does medial rotation. Medial rotation at the hip joint. ये याद रखना. When we talk together, normally when we talk about their actions together, action of gluteus medius and minimus, we say abduction and medial rotation. Out of this, who does abduction? Medius. And who does medial rotation? Minimus. ये याद रखना. Any other action? They also support the pelvis when one foot is off the ground. Action of gluteus medius and minimus, they support the pelvis when one foot is off the ground. Trendelenburg sign. Perfect. Come on, bacha. Can anyone tell me what is this number 1, number 2, number 3, number 4, and number 5? Structure under cover of gluteus maximus. What is this number 1 muscle? Number 1. Yes, 1, 2, 3, 4, 5. These are all small muscles. These muscles begin from the hip bone and they are inserted on the femur. These muscles are known as the pelvifemoral muscles. They begin from the pelvis, they are inserted on the femur. The pelvifemoral muscles they are known as. And what are these muscles? Number 1 is piriformis. Number 2 is the superior gemellus. Number 3 is obturator internus. Number 4 is inferior gemellus. And number 5 is quadratus femoris. Very good. Number 1 is piriformis, 2 is superior gemellus, फिर obturator internus, फिर inferior gemellus, and then quadratus femoris. Why is this important? Bacho, why are we discussing this? You get an LAQ on sciatic nerve. Bacho, you get an LAQ on sciatic nerve. So what is the sciatic nerve? It's a branch of what? Sciatic nerve is a branch of sacral plexus. Sciatic nerve is a branch of sacral plexus. What is the root value of sciatic nerve? L4, L5, S. 1, 2, 3. I was taking vivas in between. Students were not able to answer this. The root value of sciatic nerve is a must. L4, L5, S1, S2, S3. That's the root value of sciatic nerve. Now this sciatic nerve comes in the gluteal region below a muscle. What muscle is that? Answer this. Look at the slide. The sciatic nerve comes in the gluteal region below a muscle, piriformis. So if I see the piriformis, below the piriformis is the sciatic nerve. The sciatic nerve then lies on number 1, superior gemellus, obturator internus, inferior gemellus, quadratus femoris. Now it enters the thigh. In the posterior compartment, it would lie on which muscle? Adductor magnus. It lies on the adductor magnus. So all these muscles together form what is known as, yes bacha, all these muscles together form what is known as the sciatic bed. This you should know. Sciatic bed. Okay, look at this slide. One moment. Look at this slide. So sciatic nerve, 1, it's a branch of what? 2nd, how does it emerge in the gluteal region below the piriformis? You can see that's the piriformis. It lies on 1, superior gemellus, 2nd, obturator internus, 3rd is inferior gemellus, 4th is quadratus femoris, and number 5 is the adductor magnus muscle. Now it divides in the thigh into a tibial nerve and a common peroneal nerve. Tibial and common peroneal nerve. Then you have to write the relations of sciatic nerve. You have to write the muscles supplied by the sciatic nerve in the thigh, then the muscles supplied by the tibial and common peroneal nerve. Clear, bacho? Fine, clear to all of you? That's the gluteal region. So thigh is clear, gluteal region is clear. Okay, very good. Coming to the leg. Chalo bacho, leg. Can you quickly tell me the muscles in the leg? Leg is divided into 3 compartments. One is the posterior compartment here, one is the anterior compartment, one is the lateral compartment. Okay, I'll quickly go through this. Posterior compartment of the leg is divided into 2 sets of muscles, a superficial set and a deep set. The superficial set includes, number 1 is the gastrocnemius. Number 2 is the soleus. And number 3 is the plantaris. So gastrocnemius, soleus and plantaris together forms a common tendon. What is this? Tendoachilles. And this tendoachilles is inserted on the posterior surface of the calcaneum. Inserted on the posterior surface of calcaneum. Clear? Gastrocnemius, soleus and plantaris together forms a common tendon, that's a tendoachilles, inserted on the posterior surface of calcaneum. What is the action of this muscles? When they contract, they do plantar flexion at the ankle joint. Plantar flexion at the ankle joint. Yes. Middle one thirds of the posterior surface, Rutvi. Middle one thirds of the posterior surface of calcaneum. Clear? So superficial muscles in the posterior compartment, gastrocnemius, soleus and plantaris. Coming to the deep muscles. Come on, Bacho, can you tell me the deep muscles in the posterior compartment? Number 1 is the popliteus. That's a popliteus muscle. And this popliteus muscle, sorry, this is not popliteus, I'm sorry. This is the popliteus. That's a popliteus muscle. What is the action of popliteus muscle? It causes unlocking of the knee joint. Unlocking of the knee joint. So which are the deep muscles in the posterior compartment of the leg? One is the popliteus. Second is tibialis posterior, flexor hallucis longus and the flexor digitorum longus, right? The popliteus, the tibialis posterior, flexor hallucis longus and flexor digitorum longus. What is the action of popliteus? It unlocks the knee joint. Unlocker of the knee joint. These 3 muscles together, they cause plantar flexion and inversion. Plantar flexion and inversion. So the deep muscles in the posterior compartment of the leg, one is the popliteus, which causes unlocking. The other deep muscles are tibialis posterior, flexor hallucis longus, flexor digitorum longus. Action is plantar flexion and inversion. What is the nerve of the posterior compartment of the leg? Bacho, what is the nerve? Can anyone tell me what is the nerve in the posterior compartment of the leg? That's the tibial nerve. The nerve in the posterior compartment of the leg is tibial nerve. And which is the artery here? That's the posterior tibial artery. You should be very clear about the nerve and artery. The nerve is posterior tibial nerve. The artery is posterior tibial artery. What is the action of all these muscles? They cause plantar flexion at the ankle joint. You can stand on the tip of your toes, right? You can stand on the tip of your toes if your posterior compartment of the leg muscles are intact. If the tibial nerve is damaged, a person cannot stand on the tip of the toes. Remember that. Perfect. Now, what is this now? That's the flexor retinaculum. That's the flexor retinaculum. This is the medial malleolus here. This is the calcaneum. What is that? Flexor retinaculum. Behind the flexor retinaculum, what is this tunnel here? That's the tarsal tunnel, right? Behind the flexor retinaculum, that's the tarsal tunnel. So what are the structures which are passing through the tarsal tunnel? What are the structures passing through the tarsal tunnel? A very important MCQ for you. Structures passing through the tarsal tunnel, anterior to posterior, this is 1, 2, 3, 4, 5. What is 1? Tibialis posterior. What is 2? Flexor digitorum longus. Number 3 is the posterior tibial artery. 4th is the tibial nerve. And 5 is the flexor hallucis longus. 5 is the flexor hallucis longus. Clear? So the anterior to posterior, tibialis posterior, flexor digitorum longus, the posterior tibial artery, the tibial nerve, and the flexor hallucis longus. Perfect. So that's about the posterior compartment of the leg. Into the anterior compartment of the leg here, anterior compartment of the leg, which are the muscles here? The muscles in the anterior compartment, they do this. What is this now? Dorsiflexion. Yes, that's dorsiflexion. Right. Dorsiflexion is also known as extension. So what is this first muscle? That's a tibialis anterior. What is this muscle? That's an extensor hallucis longus. Now this muscle will go to the digits here. What is that? Extensor digitorum longus. And there's one muscle which goes here. What would this be? Peroneus tertius. Peroneus tertius, right? So muscles in the anterior compartment of the leg, tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Which is the nerve of this compartment, Bacho? Which is the nerve of this compartment? That's a deep peroneal nerve. Deep peroneal nerve. and which is the artery here? Anterior tibial artery. The nerve is the deep peroneal nerve. Artery is the anterior tibial artery. What is the action of this muscles? They do dorsiflexion at the ankle joint. If this deep peroneal nerve is injured or the common peroneal nerve is injured, all these muscles are paralyzed. The foot goes down. What is this? Foot drop. Foot drop. So foot drop occurs due to injury to which nerve? The deep peroneal nerve or the common peroneal nerve. And when there's a foot drop, how does a person walk? What is the gait? The person lifts his foot to a very high level and he puts it down. He lifts his foot to a very high level and he puts it down. What is this? High stepping gait. The foot goes down, that is foot drop. The gait which is seen here is high stepping gait or stamping gait or marching gait. Clear hai bachcho? So anterior compartment is clear. Tibialis anterior, extensor hallucis longus, extensor digitum longus, peroneus tertius. A very important, a leg is very important from practical point of view. Nerve is deep peroneal nerve, arteries, anterior tibial artery. Now coming to this compartment, coming to the lateral compartment, which are the muscles in the lateral compartment of the leg? That slide for that. I don't have the slide, but you can tell me which is the muscle in the lateral compartment of the leg. One is peroneus longus and the other one is peroneus brevis. Peroneus longus, peroneus brevis. What is the nerve of this compartment? That's the superficial peroneal nerve. And which is the artery of this compartment? It's the peroneal artery. Peroneal artery. So lateral compartment, muscles are peroneus longus, peroneus brevis. The nerve is superficial peroneal nerve. The artery is peroneal artery, which is a branch of posterior tibial artery. A very important MCQ, bacho. A very important MCQ for you. Peroneal artery is a branch of. Peroneal artery is a branch of posterior tibial artery. Branch of posterior tibial artery. What is the action of all these muscles? They do this. What is this? Eversion of the foot. Eversion. Clear? So leg is clear. No, leg only muscles you have to know. Anterior, posterior compartment, lateral compartment. The actions of this muscles. Foot drop comes as a short note for you, and the gait you have to know. And you get clinical MCQs on this, clinical questions on this. Clear, bacho? Okay, let me tell you the layers of the soul. Look, how do you remember the layers of the soul? I'll just make this for you. That's a great toe. And that's a little finger. Inversion बच्चा posterior compartment of the leg के muscles करता है. Posterior compartment, deep muscles. Tibialis posterior, flexor hallucis longus, flexor digitum longus. This muscle is just plantar flexion. They do inversion. Inversion in addition is done by tibialis anterior also. Tibialis anterior. Okay. Soul. Layers of the soul. There are 4 muscular layers in the soul. I'll just write this for you. 4 muscular layers in the soul, out of which the first layer and the third layer, the muscles begin from the bones of the foot and they are inserted into the bones of the foot. Begins from the bones of foot, inserted into the bones of the foot. Such muscles are known as intrinsic muscles. Intrinsic means chote, small muscles. Intrinsic muscles. First and third layer, small muscles, intrinsic muscles. Second and fourth layer, they have intrinsic muscles as well as muscles coming from the leg, from the posterior anterior compartment of the leg. So it's a mixed layer. Intrinsic as well as extrinsic muscles. Whereas first and third layer are intrinsic. And intrinsic chote muscles, they end with what? Brevis. They will end with brevis. How do you remember this? Put an abductor here. And put a flexor in between. Chalo, naam bol sakte ho? Can anyone tell me the name? This is abductor of the great toe, abductor hallucis brevis. Now I write it in a different way. This is abductor hallucis brevis. This is abductor digiti minimi brevis. Abductor digiti minimi brevis. And in between is the flexor digitorum brevis. Flexor digitum brevis. So abductor, beach mein flexor. Abductor hallucis brevis, abductor digiti minimi brevis, flexor digitorum brevis. Okay, sole of the foot comes for MCQs only. So just remember this. Third layer, take flexors on both the sides. Put a flexor here, put a flexor here, and put an adductor here. So, इसका नाम क्या होगा? It's an intrinsic layer. So, what is the name for this? Flexor hallucis brevis, flexor digiti minimi brevis, and this is the adductor hallucis. You remember this adductor pollicis? This is adductor hallucis. Clear to all of you? Abductor, abductor, flexor. In the third layer, take flexors on both the sides. Flexor, flexor, adductor. Flexor hallucis brevis, flexor digiti minimi brevis. In between is the adductor hallucis. Now, second layer contains muscles which come from the leg. This is the flexor hallucis longus, flexor digitorum longus, lumbricals, and flexor digitorum accessories. Flexor digitorum accessories. Clear? So, flexor hallucis longus, flexor digitorum longus, lumbricals, and the flexor digitorum accessories. And the last layer contains tibialis posterior, peroneus longus, and introsci. Tibialis posterior, peroneus longus, and introsci. So that's how you remember the layers of the sole. That's a very easy way to remember the layers of the sole, bacho. If you look in the books, it's given very difficult. That's how you remember. First layer intrinsic, third layer intrinsic, second and fourth is a mixed layer, intrinsic and extrinsic. First layer abductor, abductor, beach mein flexor. So abductor hallucis brevis, abductor digiti minimi brevis, flexor digitorum brevis. Third layer, take flexors on both the sides, flexor hallucis brevis, flexor digiti minimi brevis, adductor hallucis in between. Second layer, muscles from the leg, flexor hallucis longus, flexor digitorum longus, lumbricals, and the flexor digitorum accessories. The last layer contains tibialis posterior, peroneus longus, and the introsci. Fine, students. This is clear. Rutvi, very good. Very good. Rutvi is answering. Yes. Very good. Clear to all of you? Okay. So that's about the leg. Now you get MCUs on this venous drainage of lower limb. Venous drainage of lower limb. So venous drainage of lower limb aata hai. So you have to write about the superficial veins. You have to write about the deep veins, and you have to write about the perforating veins, right? So superficial veins mein kaun se? Great saphenous vein, short saphenous vein. You have to explain that. So how are these veins formed? I'll just draw a slide for you, and quickly you tell me. That's a dorsum of the foot, dorsal aspect of the foot. On the dorsum of the foot, we get an arch here. What is this arch known as? Dorsal venous arch. There's a vein which comes from the great toe. There's a vein which comes from the little finger. इसका नाम है medial marginal vein, lateral marginal vein. So the medial marginal vein joins with the medial end of the dorsal venous arch and forms the great saphenous vein. What is this vein? Short saphenous vein. Okay. So how is the great saphenous vein formed? By the joining of the medial end of the dorsal venous arch with the medial marginal vein. The short saphenous vein is formed by the joining of the lateral end of the dorsal venous arch with the lateral marginal vein. The great saphenous vein goes in front of the medial malleolus, goes on the medial aspect of the leg, thigh, and then pierces the cribriform fascia, opens in the femoral vein. Short saphenous vein goes behind the lateral malleolus, lies in the posterior compartment of the leg, pierces the roof of the popliteal fossa, opens in the popliteal vein. Clear? And then you have to write about the perforating veins. The deep veins consider deep veins are the veins which accompany the artery, the femoral vein, the popliteal vein, the anterior posterior tibial vein. So first explain the great and short saphenous vein, then explain the deep veins, and then you write about the perforating veins. So perforating veins are the ones which connects the superficial and the deep veins, right? So how many perforating veins are there? One is in the region of adductor canal. It connects the femoral vein with the great saphenous vein. The second is in the region of adductor canal. Yes. In the mid-thigh. That's in the region of adductor canal. It connects the great saphenous with the femoral. The second is just below the knee. It connects the great saphenous with the posterior tibial vein. Now, in the leg, on the medial side, there are 3 perforating veins. On the lateral side, there's only 1 perforating vein, right? On the lateral side, see, we divide the leg into 3 parts: upper 1/3, middle 1/3, lower 1/3. Like, if that's the leg here, अगर ये leg है, we divide the leg into upper 1/3, middle 1/3, lower 1/3. Upper 1/3, middle 1/3, lower 1/3. So at the junction of middle and lower thirds, look, at the junction of middle and the lower thirds, this is a perforating vein. On the lateral side, in the leg, at the junction of middle 1/3 and posterior and the middle and the lower 1/3, there's a perforating vein on the lateral side. On the medial side, there are 3 perforating veins. One is at the junction of middle 1/3 and the lower 1/3. Second is behind the medial malleolus. And third is between the two. Okay, so 3 perforating veins on the medial side. One is at the junction of middle and lower 1/3. Second is behind the medial malleolus, and third is between the two. Then you have to write what does this perforating vein connect, and then you have to write about the varicose veins. Varicose veins, right? Varicose veins. If the valves are damaged, the varicose veins occurs, and complication of varicose veins, varicose ulcer hota hai. Oozing of blood makes the skin dark in color. Then varicose ulcer does not heal. Rise in local temperature. Cosmetically, it looks bad. So that's about the varicose veins. Clear? So venous drainage of lower limb is a very important LAQ. Superficial veins, deep veins. You discuss the perforating veins. The adductor canal perforator, below the knee perforator. In the leg, on the lateral side 1, on the medial side 3 perforators. Fine, and then you write about the varicose veins. Clear, bachcho? Regarding arches of the foot, you have to write about the medial longitudinal arch, lateral longitudinal arch, which are the bones which takes part in the formation of the medial longitudinal arch: the calcaneum, the talus, the navicular, the 3 cuneiforms, and the 3 metatarsal bones. This is going to form the medial longitudinal arch. The lateral longitudinal arch will be formed by the calcaneum, the cuboid, the 4th and 5th metatarsals, right? So first you have to write the bones which takes part in the formation of the arch: the calcaneum, talus, navicular, 3 cuneiforms, 3 metatarsals. Lateral longitudinal arch, calcaneum, cuboid, 4th and 5th metatarsals. Then you have to write the ends of the arch: anterior and posterior end. So for the medial longitudinal arch, anterior end is formed by the heads of the 3 metatarsal bones, posterior end is formed by the calcaneum, medial tubercle. Lateral longitudinal arch, anterior end is 4th and 5th metatarsal bones, posterior end is again the calcaneum. Then you have to write the highest point on the arch, summit. For the medial longitudinal arch, the summit of the arch is the superior articular surface of talus, the trochlea tali. For the lateral, it's the calcaneum, the superior articular surface of calcaneum. The main joint of the arch, which is the main joint of the medial longitudinal arch, the talocalcaneo-navicular joint. Talocalcaneo-navicular. For the lateral longitudinal arch, which is the main joint. Anyone? Bolo bachcho, for the lateral longitudinal arch, the main joint. Easy hai? Arches of foot is very important. Huh? So first the bones which takes part in the formation of the arches. Second you have to write the ends of the arch, anterior and posterior end for the medial and lateral. Then you have to write the highest point of the arch, summit. So medial longitudinal arch ka highest point is the trochlea tali, talus ka articular surface, superior articular surface. For the lateral, it's the calcaneum. The main joint of the arch, talocalcaneo-navicular. For the medial longitudinal arch, for the lateral longitudinal arch is calcaneo-cuboid joint, calcaneo-cuboid. Then you have to write the factors which maintain the stability of the arch. How is this arches maintained? Otherwise, the arches will become flat. So one is the shape of the bones. Like agar ek concave hai, the other one is convex. They fit into each other. Second, yes. So one is the shape of the bones. The second one is the intersegmental tear. Intersegmental tear are ligaments, and these ligaments are going to hold the bones together. For the medial longitudinal arch, who's going to support the medial longitudinal arch? The spring ligament. Spring ligament. For the lateral longitudinal arch, it's the short and long plantar ligaments. Okay, this is intersegmental tear. Third is tie beams. Tie beams matlab the two ends they bring close like this close. So who's this? Plantar aponeurosis and the muscles in the sole. They bring the two ends together. So this is tie beams. So what are the factors which maintain the stability of the arches? Number one is the intersegmental tires. These are the ligaments. For the medial longitudinal arch, spring ligament. For the lateral longitudinal arch, short and long plantar ligaments. Third is tie beams, which brings the two ends closer, the plantar aponeurosis, the muscles in the sole. And the last support are the slings, the muscles which are coming from up, inserts into the bones, they pull the arch up. For the medial longitudinal arch, the sling is formed by tibialis anterior, tibialis posterior. For the lateral longitudinal arch, it is formed by the peroneus longus and peroneus brevis. Peroneus longus and peroneus brevis. So then you have to write about the applied anatomy. If the foot is flat, that's pes planus. If the foot is highly arched, it's pes cavus. If the person is walking on the outer border of the foot, this is talib. This is what? What deformity? Outer border, varus. If the person is walking on the inner border, that's valgus deformity. Valgus. Okay. If the person is walking on the toes, it is equinus. If the person is walking on the heel, it is calcaneus, talus calcaneus. Talus equinus, talus calcaneus. What is the most common deformity? Talus equinovarus. Talus equino means the person is walking on the toe or walking on the toes on the outer border of the foot. Talus equinovarus deformity. Okay, that's about the arches of the foot. Yes, Niyajit? Clear no, bacha? Yes, Rutvik? Rest of you? Very good. Deltoid ligament, Vinay, deltoid है ना बच्चा? Deltoid ligament is a triangular ligament. Deltoid ligament का apex is attached to the medial malleus and then it divides into three parts: anterior, middle, posterior. Anterior is known as tibio-navicular because it is attached to the navicular tuberosity. The middle part is known as the tibio-talar part and the posterior one is known as the tibio-calcaneal part. Okay, so tibio-navicular, tibio-calcaneal, tibio-talar part. So this looks like a triangle. A triangle is known as deltoid ligament. Fine. But then you get question on hip joint. Hip joint पे बच्चा type of joint लिखना है. The bones taking part in the formation of joints. What are the factors which maintain the stability of the joint? One is the capsular ligament. Capsular ligament, उसका attachment लिखना है. Then you have to write about the glenoid labrum. Glenoid cavity का labrum. The acetabulum is not a circle. No, acetabulum is not a complete circle. Can anyone tell me what is this ligament which is bridging the acetabulum? ये कौन है? Anyone, bacha? Come on, come on. Anyone? What is this ligament which bridges the acetabulum? Yes, very good. What is this ligament? Bolo. This is the transverse acetabular ligament. Transverse acetabular ligament. Okay. What is this? This is the glenoid labrum. So a glenoid labrum, transverse acetabular ligament, and then from the head of the femur, there's a depression here. What is this ligament? That's the ligament of head of femur. Ligament of head of femur. Then the capsular ligament, iliofemoral ligament. It's a Y-shaped ligament, ligament of Bigelow, and this iliofemoral ligament prevents the hyperextension at the hip joint. Second, pubofemoral, ischiofemoral ligament. So ये ligaments लिखने के बाद, once you are done with this ligament, you write the relations of the hip joint. A diagram you have to draw about the relations. The same: anterior, posterior, medial, lateral. पीछे hamstrings है, आगे the muscles of the anterior compartment of the thigh. Medial is medial compartment of the thigh, right? Then you have to write about the movements: flexion, extension, medial adduction, abduction, medial rotation, lateral rotation. Fine. Nerve supply, blood supply, and finally you have to write about the applied. 2-3 points लिखो applied का, that's fine. Okay. Knee joint comes as an LAQ. Describe the knee joints under the following heads. Okay. So in that, what is important is the menisci. Menisci. The medial meniscus, lateral meniscus. What is the arrangement? Can anyone tell me? That's a medial meniscus. That's a lateral meniscus. What is this in between? Anterior cruciate ligament. That's the posterior cruciate ligament. Okay, so you know this, no? So anterior horn of medial meniscus, the anterior cruciate ligament, the anterior horn of lateral meniscus, we come behind the posterior horn of lateral meniscus, the posterior horn of medial meniscus, and the posterior cruciate ligament. The medial meniscus is C-shaped, the lateral meniscus is O-shaped. What is the function of meniscus? These are made up of fibrocartilage. They prevent friction and they act as shock absorbers. Right? Then cruciate ligament, you have to know. Cruciate ligament is another very important thing. These are egg-shaped ligament. The anterior cruciate ligament begins from the anterior aspect of tibia. The anterior cruciate ligament goes behind, gets inserted on the posterior aspect of the medial surface of lateral condyle. Okay, anterior cruciate ligament पीछे जाता है, so it gets inserted on the posterior aspect of the medial surface of lateral condyle. The anterior cruciate ligament prevents this. What is this? Anterior displacement of tibia on femur. Right, anterior cruciate ligament prevents the anterior displacement of tibia on femur. And this anterior cruciate ligament is taut during extension. Anterior cruciate ligament is taut during extension. Are you following this, bachcho? See. One moment, just give me one moment. Okay, so that's a femur here. This is the lateral condyle, this is the medial condyle. So this is the lateral surface and that's the medial surface. This is the lateral and that's the medial surface. Okay, of medial condyle, right? That's a lateral condyle, that's a medial condyle. कैसे याद रखते देखो? How do you remember this? That's a medial condyle. Lateral condyle का that's a medial surface, that's a lateral surface. Medial condyle का that's a medial and lateral surface. So anterior cruciate ligament begins from the anterior aspect of tibia, comes and gets inserted on the posterior aspect of posterior aspect of the medial surface. Posterior aspect of the medial surface of lateral condyle. Okay, so anterior cruciate ligament comes backwards, gets inserted on the posterior aspect of the medial surface of lateral condyle. Posterior cruciate ligament begins from behind, from posterior aspect of tibia, goes and gets inserted on what is that? Anterior aspect of the lateral surface of medial condyle. Anterior aspect of the lateral surface of medial condyle. You're following this? ACL comes, I can draw it like this, right? Both these cruciate ligaments are intracapsular and extrasynovial. They are within the capsule but outside the synovial membranes. The anterior cruciate ligament prevents the anterior displacement of tibia on femur. The posterior cruciate ligament prevents the posterior displacement of tibia on the femur. The anterior cruciate ligament gets tensed during extension. The posterior cruciate ligament becomes tensed during flexion. Clear, bacha? Is this clear? Both the cruciate ligaments are intracapsular but extrasynovial. Yes, बच्चों समझ में आ रहा है ना? ACL, PCL. Huh? That's very important. Huh? This comes as a short note also. And this cruciate ligaments are injured when there's a forceful rotation. And this repair of cruciate ligament is done by arthroscopy. Arthroscopic repair of cruciate ligaments. Hello, bachcho. Fine. Just one last thing I'll tell you here. Okay, just one last thing. Cross. X and O, cruciate. X, cruciate ligament. Fine. Okay, look at this one last thing. These are the superficial inguinal lymph nodes. Superficial inguinal lymph nodes. This is the upper medial group. Upper medial group. This is the upper lateral. And that's the vertical. So this is the horizontal group. Horizontal group may there's upper medial, upper lateral, and this is the vertical group. Okay, this is the vertical group, and that's a horizontal group. Fine. Horizontal group में upper medial, upper lateral. चलो बस last thing, the upper medial group, what do they drain? They drain, yes बच्चों, come on. The upper medial group, they drain the anterior abdominal wall below the umbilicus, the skin and fascia of the perineum, including the external genitals, except the glans penis and the glans clitoris. The glans penis and the glans clitoris is drained by the deep inguinal lymph node. That's a lymph node of Cloquet, which is present on the femoral canal. So what is the superficial group drain? Upper medial group, anterior abdominal wall, skin of the anterior abdominal wall below the umbilicus, skin and fascia of the perineum, including the external genitals, except the glans penis, glans clitoris. The glans penis and clitoris drains to deep inguinal lymph nodes. They drain the vagina below the hymen. They drain the anal canal below the dentate line. They drain the cornu of the uterus, the supralateral angle or the cornu of the uterus. Clear? Very important, बच्चा बहुत MCQs आते हैं. Upper medial. Once again, the anterior abdominal wall below the umbilicus, skin and fascia of the perineum, including the external genitals, except the glans penis and clitoris. Anal canal below the dentate line. Vagina below the hymen. The cornu of the uterus, the supralateral angle of the uterus, the penile part of male urethra. Fine. Upper lateral group. What do the upper lateral group drain? They drain the back below the umbilicus. The back below the umbilicus, the skin and fascia on the lateral aspect of the thigh. They drain the gluteal region. So back below the umbilicus, skin and fascia on the lateral aspect of the thigh and the gluteal region. The vertical group drains the lower limb in the region of great saphenous vein and the short saphenous vein. I hope this is clear to all of you students. Is this clear? So lower limb, standard topics are there. एक popliteal fossa देख लो, supralateral supromedial boundary, that is sartorius semitendinosus gracialis supralateral boundary. Supromedial boundary would be formed by, supromedial boundary is formed by semitendinosus, semimembranosus, assisted by sartorius and gracialis. Supralateral boundary is formed by the biceps femoris. Infralateral intermedial is formed by the gastrocnemius. The floor of popliteal fossa is formed by the popliteal surface of femur, the capsule of the knee joint, the popliteus muscle, the fascia covering the popliteus muscle. Contents popliteal artery, vein, and the tibial nerve or the sciatic nerve with its two branches. Okay. Fine, bacho. Thank you to all of you. I hope all these things are clear to all of you. Thank you, my dear children. Thank you for a very patient listening. And lower limb is just that. Okay. I hope things are clear to all of you. See you on Thursday. Okay, I'll stop here.